Welcome to the Immune Edit. I'm Dr. Doug Jones. If your immune system feels like the enemy, or you're just tired of not feeling like yourself, this space is for you. Someone recently died from a food allergy that most people have never actually heard of. They didn't eat peanuts, they didn't have shellfish, they didn't ignore their epinephrine. This is something that waits 3 hours, 5 hours, sometimes 8 hours. And what makes this even more dangerous is this is an allergy that's no longer rare. Today on the Immune Edit, we're talking about an allergy that breaks every rule. Not to scare you, but to aware you and prepare you, as we hope that this is not ever missed again. Researchers at the University of Virginia documented the first known death from something called alpha-gal syndrome, which is a tick-borne red meat allergy. And this was involving a 47-year-old New Jersey man. He was an airline pilot, and this man became ill after eating a steak dinner while camping, and then sometime later died after eating a hamburger at a barbecue. What happened to this gentleman? The cause of death was severe anaphylaxis to something called alpha-gal syndrome, which is from an alpha-gal sugar molecule found in beef, pork, and lamb, and it's actually triggered by a tick bite. Weird, right? Like I said, it breaks all the rules. And while previously believed to only to cause severe non-fatal reactions, this case was the first to be definitively linked as a fatality to the syndrome. So what is alpha-gal syndrome? It's an IgE-mediated allergy to something called galactose 1,3. Can you edit this? Sorry. So what is alpha-gal syndrome? Alpha-gal syndrome is an IgE-mediated allergy, and it's to something called galactose alpha 1,3 galactose. That's a mouthful, which is why we just shorten it to alpha-gal. Now, this is interesting because it's a carbohydrate that's found in non-primate animals. What do I mean by that? Things like beef, pork, lamb, venison, gelatin, even some dairy products. Usually not turkey, chicken, or fish. Okay, so it's more kind of those red meats. Most allergies actually are caused by reactions to proteins. Well, this was also unique because alpha-gal is different. It's a carbohydrate epitope, which means digestion takes longer, absorption is different, and the immune activation is delayed. Why is this important? Because the hallmark feature is anaphylaxis occurring 3 to 8 hours after ingestion. Again, that kind of breaks the typical rules. Usually when we talk about like peanut allergy or milk allergy or something like that, anaphylaxis is occurring within 15 minutes to, maybe 30 minutes after ingestion. And it's very easy to identify. This one, on the other hand, breaks the rules where it's 3, 4, 5, 6, 8 hours after ingestion where you're getting anaphylaxis. And so that time course isn't the same. And so it's often missed. And this is one where, again, it just kind of violates everything that clinicians thought. This is kind of one where alpha-gal looked at the allergy textbook and said, yeah, I'm not doing that. I'm not doing that. Further, it's a tick bite that creates the allergy. What? Like, what does that really mean? Well, what happens is there's a vector, or what we call a lone star tick, And while that tick is biting a human or feeding on that human, saliva from the tick enters our bloodstream. From the tick bite, what enters into our bloodstream is something called an alpha gal containing glycoprotein. It's like this sugar protein that enters our bloodstream from the tick bite. When that happens, our body creates an immune response to that, meaning we start making something called alpha gal specific IgE. So that future exposures to this, meaning we get that exposure through the meats that I listed before, beef, pork, venison, those types of meats, when our body is then exposed to those meats, because we've made this alpha gal specific IgE, after consuming those meats, we can have an anaphylactic reaction. But it's different than like the typical milk, egg, wheat, peanut type of anaphylaxis because it's delayed. Why is it delayed? It's delayed because this is more of a sugar epitope, not a protein. So the digestion is different. So it's delayed. That's why it's often missed. And the thing of it is so you're not born with alpha gal. It's not genetic, it's not hereditary. You acquire it. You acquire it through the tick bites. The thing though is I remember this first being described like when I was in training. It was kind of rare. It was confined to certain regions of the United States. It is not rare anymore. It's on the rise. This is not a coincidence. As global temperatures rise, more ticks are surviving longer winters. They're having longer feeding cycles. And they're spreading further north and further west. And so they're actually appearing in places that simply didn't exist before. Like when this was first described, ticks didn't really exist in certain places. But what's scary is it's now reported in all regions of the United States, which means physicians may not expect this, patients may not recognize this, and the delay to anaphylaxis becomes even more deadly because it's just not recognized. And this is why awareness is critical now because it's affecting, again, it's been reported in all regions of the United States because of kind of the global temperatures rising. So, alpha gal is high risk because reactions are delayed, severity is unpredictable, triggers are dose dependent, again, kind of going against the typical rules of anaphylaxis, and cofactors can really amplify reactions. What do I mean by cofactors? Cofactors such as alcohol, exercise, NSAIDs. What are NSAIDs? That stands for non-steroidal anti-inflammatory drugs. Things like ibuprofen or Motrin, Advil, aspirin. Those types of medications can be a cofactor. Illness, high-fat meats. Those types of things all create kind of this immune volatility. So that again, this alpha gal is so unique because it just breaks all the rules, all the typical rules that we think of. The reactions are delayed, meaning sometimes symptoms begin during sleep. Because if you had, say, a steak dinner or a hamburger at a barbecue, like this gentleman did, it doesn't present immediately. It may present in the middle of the night. They may start having hives, shortness of breath, wheezing, all of those kinds of things in the middle of the night. But because it's the middle of the night, some people may downplay those symptoms. They may ignore those symptoms. Epinephrine is often delayed in terms of being given. Emergency medical services are often delayed in being called. Recognition is often delayed. So, this recent death kind of underscores a lot of these important points that are missed, not at fault of anyone. It's just it's under recognized, which is the whole point of today, to try and raise awareness, to try and raise our understanding of this so that if somebody is experiencing these types of symptoms, we can recognize them quicker, treat them more promptly, activate emergency medical systems quicker. And this is a real world danger. This isn't fear based medicine. If you've listened to me, that is not what I'm about. I'm not about scaring. I'm not about fear. I'm about education. I'm about empowerment. I'm about awareness and correct understanding. Ultimately, this is just about biology. And what can happen is when somebody has this, these patients can live with a lot of fear of eating at night, anxiety around sleep, social isolation, typical to your other food allergy patients, kind of medical gaslighting, if you will, hypervigilance or fatigue. Alpha gal doesn't just change the diet, it changes how safe the world feels to that person. It kind of intrudes on their life. So, just to kind of break down some of the myths. Some myths are it's not a real allergy. Wrong. It is IgE mediated, causes anaphylaxis. It may break some of the typical traditional rules, but it's still an allergy and it is still potentially life threatening. The other myth is if you tolerated meat once, you're going to be fine. Not necessarily, because the severity varies. It may vary on the amount that you've eaten. This is where, again, where it's different than other allergies. It may vary depending on how much you ate. It varies depending on those cofactors that we talked about: sleep, exercise, alcohol, medication ingestion, those types of things. So it's critical that we pay attention to those. The myth of, well, just avoid red meat then. Not so much, because this particular protein or sugar can also be found in gelatin, dairy, medications, biologics, implants, a lot of things that we don't think of. The other myth, a low IgE equals a mild allergy. No, as you've heard, hopefully, from my previous podcasts or Instagram, low IgE does not equal severity. It has poor correlation with severity. So we can't just take that and dismiss it. So how do we diagnose this? Great question. There are some alpha gal specific blood tests. We can do some skin tests. Clinical correlation is absolutely essential. As you've heard me before, just like real estate agents, if they're trying to sell a house, they always say location, location, location. When we're talking about food allergy, it's always history, history, history. So that clinical correlation is essential. Sometimes skin testing can be unreliable, so we always want to correlate our testing with the history. And currently, geography should not exclude a diagnosis. As I mentioned before, this has now been reported in every region of the United States because those global temperatures are up. Tick lives and feeding seasons are longer. Uh, so we can't exclude that just based on where you live. So awareness saves lives. What we want to do is now move into what kind of treatment can occur with this. Obviously, we want to get a correct diagnosis, strict mammalian avoidance, epinephrine with you at all times, and then the cofactor education. What are things that can put you at risk, which we talked about before? Tick bite prevention. You're not getting tick bites, you're not getting alpha gal. That's kind of a key point. And then some emerging discussions are treatment with, there's research into immune tolerance pathways such as oral immunotherapy. So there are some that can do oral immunotherapy for this condition. We have some mast cell stabilization strategies, And we may also consider omalizumab as a reaction severity modifier. So those are kind of some of those emerging discussions and treatment pathways that we have. What gives us hope? First of all, increasing recognition, improving our emergency protocols, broader clinician education so that we're recognizing this and realizing like this is in our communities now. And then obviously understanding our patient's experience. Um, we want to understand the patients, we want to hear them, we want to validate them. There are whole communities out there dedicated to advocacy for alpha gal syndrome. I applaud you. Um, and please listen to them. I always think hope exists, but we always want hope with a plan. So, with increased awareness, increased understanding, some of the things that we can now talk about is just getting a better appreciation for what this is, that it likely is in your neighborhoods, that sometimes when things break the rules, it doesn't necessarily mean that it doesn't exist or that it's in somebody's head. More likely, it's in their biology and their immune system. Alpha gal does break all the rules. However, science explains why. Science demystifies the myths, even in situations where things may break the rules. Climate change is expanding exposure. That is not a political statement, that is a scientific statement. Delayed reactions are still anaphylaxis. So even though something's delayed, doesn't negate it. The other thing is dismissal is really dangerous. I often say, when people are having symptoms, we don't dismiss them. And even if it's something that we may not understand at the time, we have to pay attention to symptoms. Symptoms are our body's way of communicating to us. It's communicating like something's wrong here. Like if you have, for instance, your car, there's all kinds of sensors on your car. And if there's a light going off in your car, pay attention to it. Yeah, sometimes it's nothing, but you want to at least look at it and realize whether it's something or not. Pay attention to symptoms because that's how we're communicating. We need to seek to understand the symptom, seek to understand the communication first, and then kind of move forward in explaining through science what's really going on. Education can save lives, and compassion matters. Maybe not quite as much as epinephrine, but it matters. We want to get treatment initiated quickly, but we also want to have compassion on those who may be struggling with different things. Alpha gal reminds us that the immune system doesn't read textbooks. As our environment changes, medicine must also adapt quickly. When patients tell us that their reactions don't make sense yet, doesn't mean they're wrong. Listen to them. Listen to your loved ones when they are complaining of something or when something happens to them. Don't just dismiss that. Listen to them. Sometimes it just means that science or our understanding just hasn't caught up yet. And until it does, awareness is how we keep people alive. So to close out, alpha gal is real. Alpha gal is spreading. Alpha gal is likely in your neighborhood. Pay attention to it. If somebody has those symptoms that may break all the rules, pay attention to that. Why is it breaking the rules? The edits that we want to make today, and this is really what I want to bring home here is alpha gal doesn't necessarily just announce itself. It waits and then it flips the table. Delayed anaphylaxis is still anaphylaxis. It can still be life-threatening. As climate changes, disease maps need to change too. And if it responds to epinephrine, it wasn't just anxiety. Pay attention to that. If it responds to epinephrine, it's not anxiety. And if a disease doesn't fit the rules, then the rules need to change, not the patient. Let's practice understanding. Let's work on hearing. Let's work on understanding how our bodies are communicating. This may be something that's less common, but nonetheless, it's out there. And I want to raise awareness on an important topic because right now, there's a family out there who has a family member that they lost. And my heart and my compassion go out to them. And it's really such an unfortunate situation. And this is nothing that anyone ever wants to capitalize on. This is something where we want to just raise awareness, be so sensitive to what that family is going through, and understand that when we have better understanding, when we bust through myths, when we break through the nonsense that social media feeds us, that maybe we can make a difference. Speak up, help, reach out. And that's the message for today. Thank you so much again for tuning in. We'll see you next time on The Immune Edit. This show is separate from my clinical practice at Global Allergy Immune Network. This show represents my opinions and my guests' opinions. Neither myself nor the show endorses the views or statements of my guests. This show is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. This show is provided with the understanding that it does not constitute medical or other professional advice or services. If you're looking for help in your journey, please seek out a qualified medical practitioner. It's important to have someone in your corner who is a trained and licensed healthcare practitioner who can help you make changes, especially when it comes to your health.